Peter, we have a question from Brenda Wilson. How long does it take to recover from an ACL injury?
Another good question, Brenda. Well, as Dr. Harner pointed out, when you have a complete tear of an ACL ligament, there's no chance that that ligament will spontaneously heal by itself. So the question arises, what do? Do you change your lifestyle and avoid sports that have a high risk of re-injury, or do you maintain the level of sports that you were involved in when you originally tore your anterior cruciate ligament? And most people, given an option, would rather maintain their ability to go back and play that same sport with a high degree or higher degree of safety. So when you tear your ACL, the majority of people, especially young active people, will opt for a ACL reconstruction. The recovery of an ACL reconstruction depends on many things, but most of the time it takes at least 6 months and up to a year before an athlete, both physically and psychologically, recovers to the point where they feel comfortable going back and participating in sport. More and more studies are showing that the fear of re-injury may be a factor as to whether or not an individual athlete returns to a particular sport. So we're learning more and more about what we should factor in to our success rate when we look at recovery. But specifically in regards to your question, it usually takes at least 6 months and up to a year for somebody to recover, not necessarily from an ACL injury, but rather from an ACL reconstructive procedure.
I'd like to follow up Brenda's question, and Chris, you know, one of the things that unfortunately we're all seeing is younger and younger athletes coming in with ACL tears. And there used to be a principle that if you were a 9 or 10-year-old or 11-year-old, we'd brace you to try to keep you from, you know, having to have surgery with open growth plates that you talked about nicely in your presentation. We know that probably doesn't work so well. So how do you handle that, the very young, skeletally immature athlete? Is there a way to avoid surgery if I'm a parent bringing that child in to see you? And if not, then how do you manage that problem with open growth plates?
Well, as Peter's mentioned, there's actually been a number of clinical studies that have shown in outcomes that children with torn ACLs do worse than children who without surgery than children who've had surgery. The problem is if you don't repair the ACL, they go on to re-injure and they start damaging articular and meniscal cartilage, and that's the beginning of major problems in arthritis. So it's important to do one of two things. You can restrict a child from play, but we all know how hard that is to do, or you can undergo surgical treatment. And remember my first slide, kids are not little adults. It's different surgery. It's done, it needs to be done by someone who specializes in that technique. It's a different graft. It's a different technique for putting the graft in a position so you don't damage your growth plate. And I think it's very important for the parents out there to know that they need to find the right person to address this injury. And they must be able, if they have meniscal tears, to repair those tears and not take them out.
Yeah, I think those are really important principles because, again, if I'm a parent, I may not understand that a 12-year-old skeletally immature child is quite different than an 18-year-old who can be treated with a standard ACL reconstruction.
That's an excellent point, and that's why we all spoke about those different age categories, Jimmy on the shoulder and elbow, me on the knee. The ages, even within a child, are different than adults, but the ages within that childhood from 2 to 18 are totally different too.
Sure. Well, we have another question that kind of is along these lines, so we'll stay with this, and Chris, we'll start with you, but we'll see if others want to chime in on this. And this asks a really hot topic that was mentioned by you, Chris, is comment on the anatomic differences as the primary risk factors for the risk of ACL injuries in female athletes. So you said that female athletes have a 2 to 8 times increased likelihood of tears compared to their male counterparts. What are some of the reasons that we've found in the literature in the last 15 to 20 years?
There's been a lot of studies, and I don't think we know the answer, unfortunately. I think we have some pretty good ideas, but we don't know the true answer. It's probably multifactorial, so it's not any one thing. I think a lot of studies have shown that it's neuromuscular imbalance, the inability to cut and pivot the same way that puts your ACL at risk. Being not in top condition, and if you fatigue earlier, you're at more risk at tearing ligaments in that situation, especially in sports such as soccer and basketball for women. Women are different than boys, so in addition to the ages different in this pediatric group, gender's different as well, so we have to keep that in mind. Females, I think, are probably more predisposed because their anatomy is a little bit different. Their knees are a little bit more knocked. They don't have quite as much muscular development, and yet their coaches are demanding just as much as out of the girls as they are out of the boys. They want to win just as bad, so they're pushing them just as hard. And I think it's a combination of factors that have led to this increased number, and that number is real. It's been shown in so many studies. Why? We're still trying to find the answer.
Lyle, do you have any thoughts on your experience on why we might be seeing this epidemic of female ACLs?
I think part of it may be anatomic, some of it may be hormonal. I think we have to sometimes remember that these kids are culturally deconditioned. They're living in urban settings. They're spending a lot of time with their computers and so forth. Why girls are more susceptible than boys in this environmental situation, I don't know. But I have a feeling that my grandmother, who was in a rural situation, probably would have not have torn her ACL if she played soccer.
And Peter, what do you think?
I think that's an interesting point that Lyle...
What do you think about Lyle's grandmother?
She must have been a wonderful lady. I'm sure she was. No, I think Chris has brought it out, and Lyle also, that at the end of the day, we really don't understand why there's anywhere between a 2 to 8 or 11 time increased incidence of ACL injuries in females. And there's a lot of research going on to try and answer that very, very critically important question for all the ramifications that result from a young woman tearing her ACL, particularly at an early age. So let's get that question answered, and hopefully in the next few years we'll have the science to back up the answer itself.
Yeah, Chris, you have another point.
There are a lot of studies on prevention, so I'm sure a lot of the parents and coaches wanted about preventing ACL injuries. And the studies have shown that if certain exercises are followed the correct way, they can decrease the risk of ACL injuries. They've shown it in Europe, the United States. Now the problem is those exercises has to be done specifically the way they were taught, and they have to be done on a daily basis. You can't kind of do it here and then go off. And the problem is with preventive exercise that may decrease risk is it's very hard for the athlete to comply with those exercises. They're very boring. And to have kids do these step jumps and then back and forth and spend a half an hour before practice doing those things, it's very hard for coaches to do that. So prevention probably is a good idea. Getting these young athletes to do it is another story.
Yeah, I think that's an important point. Tim Hewitt's group in Cincinnati has really been at the forefront in the United States in trying to get some of these preventative programs to their young women athletes, and they've shown definitively that while they participate in these programs, they decrease the risk of ACL tears, but the compliance is really the problem, as Chris mentions. There's also some quadricep hamstring ratio differences that we've shown in our research at Columbia, that the post-menarchal female athletes becomes much more quadriceps dependent than their younger female counterparts. So there's probably some muscular component as well. But I think the bottom line at this point to answer the question is that it's still an ongoing area of hot research and investigation around the world because we're all experiencing it, but we're still trying to get our a handle on exactly why it's happening. Here's a question for you, Lyle. Both the cycling and soccer clubs do a good job of strength training, but what action should be taken if a minor injury occurs? And this comes to us from David Ballas. Thanks, David, for that question.
The first aid for any sports injury, relatively minor, carefully assessed by the trainer or the doctor, is RICE. Relative rest, as you've heard many times tonight, icing, compression, and don't forget elevation. Elevation can be very helpful, particularly for foot and ankle injuries. And there's no such thing as a minor sprained ankle. We can certainly limit the amount of injury from that injury to the ligament. And then with proper early attention and careful institution of the appropriate exercises and icing and so forth, the Rice principle, we can prevent it from becoming a more limiting factor for the athlete.
Great. That's a great answer to that question. And then, Jimmy, we're going to talk, probably this will be one of our last questions. Besides stretching, how can we prevent muscle tightening throughout the shoulders, back, hamstrings, and calves? This is from Vanessa Meeker. Thanks, Vanessa.
Well, I think what they have to consider is when you start off with a specific sport pre-season, you should start off at a gradual pace. You shouldn't expect him to go out there the first day of practice and practice at full speed. It takes about a week with gradual stretching exercises, gradual increasing activities, step by step, to get them into full bore practice. And that's when the problems occur with tightness in the back, the hips, the legs, and that's when injuries most commonly occur, is the first week. So remember, don't expect your young athlete, particularly if you're the coach, to go out there and have a hot day, the first practice, full blast, because that's when the injuries occur, and that's when problems like this occur that we can't prevent.
Thanks so much. And I'd like to thank everyone who's participated in tonight's webcast on overuse injury prevention in kids. We'd like to thank our presenters, Drs. Peter Indelicato, Lyle McKaylee, Chris Harner, and James Andrews, and our sponsor, DePuy MyTech, for their generous support of the Stop Sports Injuries campaign and this webcast. For more information on keeping kids in the game for life and preventing sports injuries in kids, please visit www.stopsportsinjuries.org. Thank you very much for participating.